Let me share my screen and we will get started. Okay. Good evening, everyone. I am Audrey Harris, Dr. Audrey Harris, and I am your instructor for this course. Welcome to week 1 of RAD 233. Please drop your name in the chat for attendance. And then again at the end, I typically run analytics on Zoom after class is over, so I can see how many minutes each person has attended class. After class is done, since it's being recorded, I will put it in the announcements as well as in the weekly modules for you guys to go back and repeat it, or watch it again if you'd like. I probably will also put my PowerPoints there too, since I understand some of you might be having some power problems because of all the rain. Okay. Mobile X-ray equipment in your book is pages 572 to 574, and then the surgical radiography is 598 to 607. So it's not really that many pages for you guys to read with regards to the beginning of this particular class. Okay. All right. So the first thing we're going to talk about before we can start talking about surgical procedures or anything is we need to talk about equipment, the different types of portable X-ray equipment that is actually used. There are battery powered and standard powered capacitor discharge. Those are the ones you plug in. And then there's the C-arm. Remember, with all of this, your portable machines, they're going to be CR or DR. And you remember to collimate, accurately center. Proper exposure factors need to be used. And the exposure indicator, that S number, I think is what some of the manufacturers use, okay, is the S number. So let's begin with the first type. This is battery operated and battery driven. You plug these into the wall for them to recharge the batteries. It uses 10 to 16 12-volt batteries connected in series. So if you remember anything about your physics, you do remember that if you have batteries connected in series, if one battery fails, the entire system fails. They can go from about 2.5 to 3 miles per hour, which is typically walking speed. You can go up an incline 6 to 7 degrees. And of course, you have to have some muscle power even with that. It can go forwards and backwards. There's usually a dead man switch. So when you release it, the brake comes on. You can go approximately 10 miles actually on a full charge. And a full charge of your batteries can take up to 8 hours. Okay. The next type is the standard power. This is the type of X-ray machine that you have to plug into the wall. It is not motor driven, so that means everything is with muscle power. You have to plug it in. So to go up an incline, you've really got to push it. Battery operated units provide consistent radiation output similar to a 3-phase generator, but needs to be recharged. the capacitor discharge units, it must be plugged into a wall outlet to operate and produces radiation output like a single phase unit. And you should understand that, again, from the physics classes that you've probably already taken. All right, so let's do a few questions. To show class participation, this is how I kind of like for you to answer your questions, especially if it's an A, B, C, or D answer. How to respond in the chat, Q1 meaning question 1, and then your answer, and you can see the example here at the bottom. That would be question 5, the answer is B. Okay, everybody ready? Question 1, what is the main advantage of portable X-ray machines? Is it speed, comfort, price, or mobility? Yes, very good. Very, very good. Right. Question 2, what is the source of power for a portable X-ray machine? According to what's listed here on the screen, coal, gasoline, batteries, or solar energy? All right. Question 2, the answer is C. Very good. Very good. What is a portable X-ray machine? What is it? Is it an X-ray generator? Is it a scanner? Is it a camera or a scale? What do you think a portable X-ray machine is from these 4 choices? Yes, that is correct. A portable X-ray machine is an X-ray generator. Very good. Portable X-ray machines are only used in hospitals. Is that true or false? What do you think, guys? Yes, it is false. X-ray machines are used in airports. They are used in manufacturing. They use them to manufacture tires, for building airplanes. X-ray equipment is used in a lot of different ways. Okay, very good. Okay, so now let us talk about this C-arm. I'm sure all of you have seen a C-arm. We're going to begin by talking about the different components of the C-arm. It typically has 2 monitors, one to view during fluoro, and then one to save the last image that it captured. Okay. There are a lot of different features about the C-arm, and I think in our next week's class, you will be able, there are some videos for you guys to watch that shows you how the actual C-arm operates. And what I would suggest to any of you, when you get into your clinical environment, when you're not busy, I know that is not often, but when you're not busy, before you have to go to surgery for the first time, with a tech, go somewhere where there is the C-arm and practice. Practice moving the locks, unlocking it and see how it moves, how you can move it up and down, how to make the tube go right and left. You need to work on that because this is one of those skills that when the more you become more proficient, the more you do it. And so you're just going to have to take some time to go and work with it, okay? Let's see. And this is basically what the C-arm looks like. Of course, when we take images, we typically do the 2 projections that are 90 degrees apart, meaning an AP or a PA, and then a lateral. Always include the entire structure if you can. But like if you're doing a long bone, for instance, make certain you get the joint closest to the site of injury. And be mindful of your radiation protection for yourself and others in the room, and also the patient. So this is a typical C-arm. It could be conventional or it could be digital. It should use high-level fluoroscopy or HLF. With HLF, it increases the number of photons, or when we talk about photons, that means mass. So increasing your mass. It improves the quantity of X-rays and it reduces noise. So in other words, it makes a clearer or more crisp diagnostic image. These are some of the components or controls on the C-arm. You use the pulse feature to lessen the exposure to the patient. It has a normal mode, and it also has a MAG 1 and MAG 2. So, of course, if you're going to magnify an image, there's going to be more radiation. You can also collimate it. There's a way to flip the image right to left and top to bottom. There is a boost on the machine, which boosts your energy. And of course, if we're going up, that's going to increase the exposure. You have locks to save. You have a lock to save the last image on your second monitor. There should be a 5-minute alarm. Technical factors where you can adjust the mass and the KV. And remember, the KVP is the penetrating power or the quality of the beam, whereas the mass is the quantity or the number of X-rays being used. Okay, the next couple of images or slides are very, very, very important, and you really need to know these. You need to know them not only for my class, but also for the registry. These are very, very, very typical things to see on the registry. All right, so here you see at the bottom, it says least exposure to the operator. You notice that the image intensifier is on top and the X-ray tube is on the bottom, okay? This is important for cath lab and OR techs. They should wear lead aprons, thyroid shields, perhaps lead gloves, depending on where they are within the field, and or lead glasses. You can get prescription lead glasses to wear. Now, this configuration again, X-ray tube at the bottom, image receptor at the top. This is the least exposure to the technologist, okay? Again, this is a definite registry question. You can count on seeing one of these pictures. Now, this is the second picture. This is a 30-degree tilt of the tube away from the technologist, okay? So it increases the exposure to your face and to your neck. The central ray angle increases exposure to the operator. Next, we have horizontal. Increases exposure on the X-ray tube end. Now, when you look at this, you see the technologist is on the image intensifier side, right? So who's on that X-ray tube side? 9 times out of 10, it's going to be the surgeon. So when you have to try and do a lateral projection of some sort, be certain to ask the surgeon to move, to step away or something of that nature, or even if it's a scrub tech or a nurse on that end, on the X-ray tube side, you want them to move away because the exposure is very high on the X-ray tube side. And lastly, when you have a vertical orientation where the X-ray tube is up and the image intensifier is down, this is not recommended at all at any time because it increases the exposure to the operator, okay? So never, never, never use this. And those 4 images, you really need to know those 4 images, okay? All right, question time, Q5. What type of imaging does a C-arm perform? Is it an MR image, a CT image, an X-ray image, or a PET scan image? Very good. Very, very good. What is a C-arm machine used for during surgery? For anesthesia, for fluoro, real-time guidance, surgical planning, or image capturing? The primary purpose of that C-arm X-ray machine is for fluoro and real-time imaging. And this is very important when you're doing cardiac caths and you're following a catheter through a vessel, or they are putting a rod inside the medullary area of a bone. They need to see where it's going. So it's very important. Very good, everyone. Question 7. What is a disadvantage of the C-arm? Takes a long time to do what? Produces loud noises, high radiation dose, or expensive to operate. Yes, very good, everyone. High radiation dose, because this is anytime you have a fluorotype exam going on, that is a continuous X-ray, and you know, that's bigger, the exposure is going to be much larger than just a static X-ray. Okay, so the disadvantage from the 4 things listed here would be higher radiation dosage. Question 8. What medical branch uses the C-arm the most? Cosmetic surgery, orthopedic surgery, cardiac surgeries, or neurosurgery? The answer is orthopedics, even though we know cardiac and neurosurgery use it a great deal in everything that they do. But ortho does it a whole lot more, because for every case, they're going to have some type of X-ray machine in the surgical suite when they're performing those orthopedic surgeries. Cardiac surgeries and maybe neurosurgeries, not quite as much, but definitely with the ortho procedures. Are C-arm procedures safe for pregnant patients? Yes, without protection. So nothing's needed. No, it's unsafe. Only with special protection, or it depends on the surgery. Exactly. Very good, everyone. No, it is not safe. Not safe. What is the C-arm's image memory used for? To store X-ray images. Oh, to save a patient's life. Transfer medical records, or provide surgical tools. Yeah. So now you can see how important it is just to read the question sometimes, because the options, there's only one that makes sense. Okay, since we have spoken now about the different types of equipment, X-ray equipment, now let's talk about the surgery. Remember the 3 cardinals, when you began in surgery, remember the 3 cardinal principles of radiation protection: time, distance, and shielding. So you stand or time the farthest distance from the source, the shortest exposure time that you can use, and shield. Shield between you and the source, meaning you have on an apron, distance, thyroid shields, glasses. Okay. So remember, in doing that, if you've done with physics, you know that doubling the distance from the source decreases the intensity of your exposure by a factor of 4, and that is the inverse square law. Okay. Surgical attributes. Now, this is very important. These four things are very, very important for a surgical technologist. You must have confidence in your ability as a technologist. So therefore, the only way that you gain that confidence is through experience. You have to, don't be afraid to go into the surgery. I know it can be very intimidating, but don't be afraid. You have to be certain of your ability. So that's why I said to you guys to begin with that you need to practice mastery, all aspects of radiography. So learn how to comfortably manipulate the machine, be familiar with all the different locks, problem solving skills, able to respond quickly and correctly to changing situations, which is something that happens a lot in surgery and in the emergency department. Situations are subject to change quickly without any notice, and got to be able to communicate with all members of the surgical team. These things are vitally important. Think critically. One of the things I've said before, when you go to surgery, you cannot be nervous, scared, or cry, okay? And the reason you can't cry is because you might contaminate the sterile field, okay? So if you let a tear hit your sterile field, the whole thing has to be put away and a new surgical field needs to be set up. So no, please do not ever cry in surgery. When you go to surgery as a student, you'll always have someone with you. So if you start to feel nervous or anxious or anything, you tell the technologist that you're working with, excuse me, you walk out of the room, compose yourself, and then come back, okay? These are the typical members of the surgical team. You have the surgeon that performs the surgery, CST or certified surgical technologist. This is the person that assists the surgeon, that passes them the instruments for the surgery. We have the wonderful radiologic technologist. We take those diagnostic images, and they're just absolutely beautiful each time. And then you have the scrub tech, or this could be a scrub tech, or it can also be an RN. This is the person that sets up the room, they scrub the patient, they make sure that all the tools are available. They can hand tools to the surgeon. A non-sterile person can hand a tool. They have to peel back the covering and the physician reaches inside and takes it out. And they also have to count all the sponges at the end of the surgery. So that scrub tech is very important. And you know, it's important to know how many different sponges that you may have used, or gauze pads, to make certain you do not sew one up. They do not sew one up in the patient. All right. The scrub tech prepares and maintains the sterile field and the instruments, and this person also gowns member of the surgical team. The OR table is only sterile at the level of the tabletop, and the surgery team is only sterile at the level of the table. So everything from about their waist down is considered non-sterile, okay? All right, now we got to talk about sterile versus non-sterile environments. What should you do? This is a question that doesn't have a number. What should you do if you slightly brush against a sterile drape during surgery? What do you think you should do? Come on, guys. I know you know. What should you do? Tell someone on the surgical team. Exactly. Because you risk that patient getting an infection from this surgery. Yes. And don't be afraid to speak up. Do not be afraid to speak. It is vitally important to tell someone. Very good. Very good. All right, protecting the sterile environment. Now let's talk about the 3 different types of drapes that are used. You have a drape that covers the C-arm to protect the C-arm itself from blood and body fluids. And you see this on the image at the top. You see they have the X-ray tube covered. They have the image intensifier covered. Then we have a drape on the patient for cleaning. After cleaning the skin, they will drape the patient. And then if you look at the image at the bottom, that is called a shower curtain drape. Now, the surgeon will be standing on the side that we're looking at, and he or she will cut through in order to do the surgical procedure. But everything on the other side is not sterile. You notice you don't see drapes on that C-arm, do you? Because they are separating the sterile side from the non-sterile side with this shower curtain drape. Protecting the sterile environment. Didn't we just talk about this? And this is just showing you again some draping on the C-arm here from the image intensifier side. So therefore, when you're doing this, when you let the machine up and down, you want to be careful not to touch the sterile field, because what they're putting on the image intensifier here in that first image on your left, that is not sterile. That is not sterile. It is just something to keep blood and body fluids from getting on the C-arm. So you can let it up and down. You can let the C-arm up and down, but don't touch that sterile field that's exposed where the patient is exposed. Let's see. Protecting the sterile environment, the shower curtain from the technologist side, and then this is the shower curtain from the surgeon side. So they will cut into the patient. I hope you guys can see the difference. This is the non-sterile side, the picture on the left. And then on the right, you have the sterile side where they will cut through the drape in order to perform the surgical procedure. Surgical asepsis. In the sterile environment, you must maintain a 12-inch distance from an open sterile field. There's at least a foot between the technologist standing next to the C-arm monitors and that person that's scrubbed for this procedure on the right. So there should be at least 12 inches. You know, you can see this on the registry as 12 inches or 1 foot. So let's see. Surgical attire. This is what needs to be worn in the sterile environment. You should have scrubs on, shoe covers, non-sterile gloves, protective apron, a head covering. If you have a beard, guys, you must put something over your beard. Surgical mask. Sometimes there are face guards, depending on what type of surgery is being done, and especially if body fluids might spray within the environment. Yes, surgical attire. Now, before, this is non-sterile, so this is just someone that's assisting with the surgery. Now, someone that is scrubbed into the surgery, they would have to put on a lead apron. So 2 types of imaging equipment in surgery. We've talked about this. There's the C-arm, and then there's the mobile X-ray unit. There's also an O arm that can be used instead of having a C configuration, like with the C arm, the O arm is an O. There's also surgical MRI, where the walls will open. You have the patient on the surgical table that is also an MR table, and the magnet comes into the room and connects with the bed in order to take images while a patient is under anesthesia. And you know, there's a whole lot of other things that you have to consider, making certain that the people have all ferrous objects removed, because we're in an MR environment. And there's also ultrasound. There's also imaging ultrasound in the surgical environment. All right, how we use sterile cassettes with the cover. If you notice the picture on the left, the sterile person that has on the gloves has her hands underneath the cuff of that sterile bag, and he or she is just simply putting it in, and then they will just cover it up, and they will be able to lift the patient on the sterile side and use this image receptor, and they just do it in reverse with taking it off. The person in scrub, hands under the fold. Technologists lift the cassette or image receptor out without touching the bag. So you reach inside the bag and pull it out. And radiation protection. In the surgical suite, you need to have your protective apron. You can wear a thyroid shield, especially if you are one that that's primarily your position as you do surgery all the time, because there's some people that absolutely love it. Working in surgery. I personally didn't care for it very much as a student or as a registered tech, but you know, you do what you have to do. You see, he also has on his dosimeter at the collar outside of the apron. This will give it his radiation dose to his thyroid and the lenses of his eyes. Believe it or not, just those glasses that he's wearing, you know, you can get prescription lead glasses, but just regular glasses will protect the lenses of your eyes to some degree. Not as much as prescription lead glasses, but they do, it can cut down the exposure that you might get to your eyes. Radiation protection with the C-arm for the least exposure. Remember, we've gone over this before. The least exposure to the technologist, where should the X-ray tube be? Should it be up or down? Okay. Place the X-ray tube under to reduce head and neck exposure. Minimize, there you go, minimize use of boost exposures, even though sometimes you have to. Minimize the distance between the anatomy and the image intensifier. So bring it as close as you can to the surgical environment that they're, the area where they're operating, but you can't touch it. Provide lead aprons for those remaining in the area, not behind lead shields. And a question, oh, I don't know, maybe it's one of the questions that I've asked here. If not, maybe I will remember. If you don't have an apron, say you don't have enough aprons in the surgical environment, and could you stand behind someone that has on a lead apron to protect yourself? What do you think? So you're standing, yes, you can. You could stand behind someone. Yes, you can. You know, this is in a situation where there's just not enough aprons in the room. Sure, You could stand behind someone that does have on a lead apron to protect yourself from exposure. Yeah. All right, question 11. The absence of infectious organisms is the definition of surgical asepsis, disinfected, clean, or antiseptic. That is correct. That is correct. The boost feature found on many C-arm systems slightly increases the exposure to the patient and the technologist. Question 12, is that true or false? The boost, I think it kind of tells you what it is just with the word boost. Yes, the boost feature increases the exposure to the patient. Very good, everyone. What is necessary before starting aseptic technique? Using hand sanitizer, using gloves, using a mask, or washing your hands. Washing your hands. Very good, everyone. Very good. Yes. Wash your hands before you start any type of, because if by chance the gloves are compromised by any means, then at least you have a clean surface underneath. Yes, so wash your hands. What is the purpose of wearing gloves in aseptic technique? Disinfect your hands. You are wearing lead gloves to disinfect your hands. That doesn't sound right. You're wearing gloves to hide infection. Increase contamination or prevent contamination. Yes, you are wearing gloves to prevent contamination. Very good. What is the minimum distance that one should be kept from an open sterile field? 18 inches, 6 inches, 24 inches, or 12 inches? Very good. Very good. It's 12 inches. And remember, you can see that as 12 inches, or you might see it as 1 foot. So I know you guys understand all of that. Oh gosh, we are at our study guide. This is the study guide. This is what's going to be on your quiz that you must take by 11:59 p.m. on Sunday, even though you can take it before then. But these are the types of things. There is I think it's a 25 question quiz for week 1. Remember what HLF is, that high level fluoroscopy, what the pulse mode does. So instead of just continuous x-ray, you pulse it to decrease the exposure the patient's getting. What's the maximum incline that you can push the battery-driven portable up? X-ray rate, X-ray exposure rate of the radiographer. Okay, why would you do a lateral decubitus? And these are some questions that you should be able to find in your reading. The ones that I did not cover specifically in our lecture tonight, those are things that you should be able to find in your reading. What is the certified surgical technologist? Who can be a certified surgical technologist? Could it be an RN? Perhaps. Know the difference between aseptic and, asepsis and aseptic technique. Sterile field, the boost exposures, and strike through. Strike through is when, say you have a sterile field and something liquid strikes through the drapes that you have. It's not sterile any longer. If water permeates through your sterile field, it is no longer sterile. Does anybody have any questions for me? Man, I got done. Oh, I have 20 minutes to go. Where will we be able to find the recording? I am going to put this. Okay, just a second, Dawn. I am going to put this in the announcements, and there's also going to be in the weekly modules. There's one for week 1 that says recording, and I'll put it in both places. And the question that you asked, page numbers, let me see. 572 through 574 and 598 through 607. Okay. Does anybody else have any questions? Guys, feel free. You have my number. You can actually text me. But remember, I'm old. And I go to bed very early. So be careful. Think of me as your grandma. Okay. So there's a certain time you wouldn't text grandma, so don't text me. But I will respond. And I am very good about paying attention to emails that might come in. How do we finish the week 1 orientation assignment on Canvas? It states to leave a comment, but I can't leave a comment. Oh, without submitting without. Take a picture of your screen, and that could be the picture, and say you're done. That's fine. That'll work. Or if you feel better, you can send me a text, you can send me an email. You got to tell me who you are, because you can't just send me a number, because I wouldn't know who that is. Okay. All right. Any other questions? Okay. All right, guys. If you have any questions, let me know. I'm almost available all the time. There you go. Thank you for putting your very good. Drop your names in the chat again. And I will see you guys next week. Okay. If you have any questions, reach out to me. Okay. Feel free. Thank you. Sharing.